Okay. And I'm not going to spend a lot of time with an introduction or anything like that. If you want to know more about me, you can go to my website, which is my name, cindybartz.com. Um, I really want to thank you guys for coming in. Just like when we play our clarinet, if we're going to do anything live for an audience, we practice. And it's the same with presentations. So this is a practice run of what I'll be doing at the ICA in Dublin. So thanks again. I think I'll mute everyone just so that we don't have like any background. So let me start with that and then we'll get started. So thanks again for coming. All right. So I have a PowerPoint. So let me go ahead and share my screen. All right. So today's presentation is yoga techniques for better breath control. And I've been a yoga instructor for, well, since 2012, and I've been practicing yoga since 2004. So I consider myself an expert. And one of the things that started happening to me is that in playing the clarinet, I really found that there was a lot of techniques used in yoga that actually can be used for playing the clarinet or really for any wind instrument. And so for today, um, we're not going to talk a lot about yoga. There are one posture that we're going to look at, and then there's going to be some breath techniques. But just so you have a little bit of understanding, I think a lot of times people think of yoga as just the posture, and it's much more than that. There's actually 8 components. One is, of course, the posture, which is called the asana. And then there's also focus and concentration as well as awareness, state of mind, and then breath techniques. So those are 4 of the 8, which these 4 I really feel are really in alignment with what we do as musicians. We all need to focus and concentrate. We all need to have a good state of mind when we're practicing, and of course the breath techniques. And there's many, over 100 different breath techniques used in yoga. And many of those can be used to increase our lung capacity as well as uh, for better breath support and control. So, what you're going to learn today in the next 25 minutes is one yoga posture, and this is going to be to increase your lung capacity. And there's plenty of other yoga postures, but this one is really easy. Like everybody can do this. So, and you actually sit in a chair when you do it, so it's not real complicated. And then I'm also going to teach you 3 different breath techniques to improve your airflow. If you've got any questions, probably the best thing to do is if you just want to type them in the chat. And then after I'm done with the presentation, what we can do is I'll go through all of the questions or any questions that you have. If for some reason you need more clarification, we can go through that as well at the end. So first of all, there's this thing called intercostal muscles, and some of you have maybe heard of intercostal muscles. Intercostal actually means situated between the ribs. And so you can see from this graphic on the right-hand side, that green part is actually your intercostal muscles. And that's where they're located. They're very important when it comes to expanding and contracting our rib cage. And as we age, if we are not using and creating ways and using movements to keep the flexibility in those intercostal muscles, they actually, just like any muscle, they become very, very tight. And over time, it would be really difficult for them to expand and contract. So that's why it's important to maybe do some different types of movements and exercises so we keep that flexibility. And there's actually 6 different movements for the intercostal muscles. You probably know that when you breathe in and you breathe out, that your rib cage actually goes up and down a little bit. But what you might not know is they actually move out left to right as well as front to back. So there's 6 different movements that should really happen with your rib cage. And so when we breathe in, it should expand and contract. So if you know my fingers were the ribs, it should be expanding. And again, it should be going out to the sides. It should be coming up and down, and it should be going front and back as well. So, lack of movement or flexibility is going to decrease your lung capacity. It makes sense, right? If you want more or improved lung capacity, one of the things you're going to have to do is create more space for the lungs. And the way to do that is to really get some really good flexibility in those intercostal muscles. So the yoga posture, and I've got a couple of slides here that show this, and I can also demonstrate this for you right now as well. But the yoga posture that I'm going to show you is really to increase the movement or the flexibility of the intercostal muscles. So it's called a seated side bend. Very, very easy to do. I actually recommend that you do it seated. You could also do it standing, but I actually don't think that you get as much benefit from it from a side bend as you do when you're seated. So I'll give you a little bit of a demonstration here. Um, I think all of you can see me. When you do this, what you really want to do, and let's say that you're going to be stretching this way, and again, it's going to be for the intercostal muscles that are next to the rib cage here. So one thing that you can do is take the opposite hand and press it a little bit down into the seat. And what this does is you want to feel like you're really pressing against the opposite hip. And then you'll bring the arm up, or you could have it on your waist as well. And then you're going to bend. And I like to think of the spine as almost like a C, that you're creating a C. And I've got, yeah, some of you are doing it. So I've got another picture here of how to do it correctly. And if you can see here, and I don't know if my mouse shows up, but you can see how the rib cage is actually coming out. When you do the posture correctly, one thing is from the base of the spine all the way up through the upper spine here should be straight up, and then you're pressing out. So in other words, I also have another picture of how not to do it. So as you can see here, you could do it this way, but if you want to increase the flexibility in the intercostal muscles, this isn't going to do it for you. This would be for if you want to work on the lower back and your hip more, maybe even into the shoulder. So when you do the seated side bend, you want to make sure that you're thinking of bringing the rib cage out away from you and still getting that nice line of energy going up from the base of the spine all the way up through the kind of the throat area here. So, and another thing that you can do to just kind of see as a way to just see if you do have that flexibility is if you take your hands here and just exhale completely. And I'm right kind of in the middle of the rib cage when I do this. And exhale completely. And then when you inhale, you should feel the ribs like move out and move up and move front and back. So if you're not feeling much of that, and you can probably see that when I do this, I'm actually the ribs are actually moving. The whole rib cage is moving. So If already when you do this and you're not really feeling much of a movement in the rib cage, this is one exercise that I would strongly recommend that you start doing. At the end of this presentation, I give you a little practice thing that you can do at home. So that's the one posture, yoga posture that I would recommend that you start with. There, like I said, there's many other ones that will actually help with the rib cage and help with getting more flexibility in the intercostal muscles. But I really feel this one is very easy, and most people will be able to do it. If you do have shoulder issues, obviously you can have your hand on your hip or even on the shoulder here for you. And of course, not just one side, but you would want to do the other side as well. So that's the posture for today that you've learned. And then there's also breath techniques. So first of all, why are they important? And it's because it affects the airflow. And these techniques, and again, there are literally hundreds of different breath techniques in yoga that can be used. I'm going to show you three today. And the three that I'm showing you really improve the speed of our air flow. It also is going to be good for getting better support and control. And it also improves the duration. So for how long that you can have that breath, because you're building the lung capacity as well. So the first one, and it's interesting because when I put this presentation together, the three breath techniques that I decided to teach you today, the first one is what I would consider an easy. So pretty much everybody will be able to do this one. The next one that I show you is going to be an intermediate, and then the last one is a more advanced. So I know we probably have some type A individuals that want to just go to that advanced. But what I would recommend is you first at least spend some time with the straw breath, and I'll show you how to do this. I'll demonstrate it in just a bit. And then again, even if you think that you want to go on to either the intermediate or the more advanced, the more you practice it, the more it's almost like a knack that you will get over time. You might think that you're doing it right away, but the more you do it, the better it's going to get, just like anything else. So with the straw breath, what this is long, slow breaths while supporting the abdominal muscles. And what this does is it helps with better control of your airflow, and it will improve the duration of your airflow. So again, because we're doing long, slow breaths in and long, slow breaths out, um, you'll get these as some of the benefits for it. So I'm going to demonstrate this. Basically, what to do is you first exhale. You can exhale out through your mouth. You want to empty the lungs completely. And then you're going to breathe in through your nose, and it's a long, slow breath in. You're going to purse your lips, and then you're going to exhale as slow as you can while supporting your abdominal muscles. One of the things that I usually tell people to do is think of your abdominal muscles as if someone was going to maybe punch you in the gut. You know, you would really want to hold that um, and support the abdominal muscles. So when we do this, and again, I'll demonstrate it again. It's going to be an exhale first out through the mouth, and then a slow, long breath in through the nose, and then pursing the lips, slow, long breath out. So this is how it'll go. It exhale, and then inhale through the nose, nice, slow, long breath in. And then pursing the lips, begin to exhale as slow as you can while supporting the abdominal muscles. And you want to keep exhaling until you empty the lungs completely. So one of the things that the mind sometimes does is you'll think that you're at the end of the exhalation, even if you think you're at the end of that exhalation, the very bottom. See if you can push a little bit more air out. I know when I first started using this breath technique, my mind actually played a trick on me because I thought I was at the end of the exhalation, but I really wasn't. And I was really surprised at how much more air I could exhale. And you probably want to do it about 5 times. Now, if you're not used to taking long, slow breaths, you might actually get a little dizzy at first when you do it. So just be careful of that. If you are getting dizzy, it's usually a sign that your body is just telling you, oh, I'm doing something different here. And you might want to just back off a little bit at first until your body gets more used to it. But I'll demonstrate it again, and I'll actually do it about 3 times so that you can see again. Again, always exhale first, get all the breath out of your lungs, and then inhale slow, long breath in. Think of really filling up the lungs completely and then pursing the lips, exhale. You're doing this while you support the abdominal muscles. And then exhale completely, all of the air out. And then as soon as that happens, you're going to inhale again through the nose, filling the lungs, purse the lips, exhale. And then again, as soon as you get down to the very bottom of that exhalation, take another breath in. And then exhale with pursed lips. So that's straw breath. It's called straw breath because if you think about it, you could also do it with like a straw in your mouth. That's kind of the technique. And the other thing is that you might want to do, I know for me, when I first started learning it, what I did is I would actually look at a clock with a second hand and see how long my exhalation was. And when I first started, it was like maybe 20, 25 seconds. I can go over a minute now. So it will help again with the lung capacity. You'll have better control of the airflow over time because you're still supporting the abdominal muscles when you do it, and it's going to improve the duration. So, you'll be able, one of the things you'll notice when you start playing the clarinet after using this technique for a while is that you'll be able to go farther along in your phrases with your clarinet playing. So I want to go on to the next one here. And I know this is like a mouthful. It's Kala or Kapal Abati, which is sometimes called the breath of fire. And again, this is more of an intermediate, and I am going to demonstrate it. If you can't do it right away, don't get discouraged. Um, it is, like I said, a more intermediate level of breath. They're quick, short, vigorous exhalations with actually an effortless inhale. And what this does is this type of breath technique improves the strength of your abdominal muscles for better breath support and control. It also improves the speed. As you know, when you play any wind instrument, not just clarinet, but any wind instrument, you want that nice quick speed of the airflow. So what you're doing is practicing that with this technique. Now, again, it is more intermediate. And when you first start doing it, you can do it kind of slow. And then once you start to really learn the technique, you can go a little bit faster with it. So again, I'm going to demonstrate this for you. And I do it with my mouth open. There is also a technique where you actually keep the mouth closed, but I think especially for wind instruments, you might as well just use it with the mouth open because that's how we get the sound is when it comes out of our mouth. So when you start out, and I like to use a hand here on my belly because what you're going to do is when you exhale, you're actually going to bring the belly in. I'll come a little bit closer so that you see what I'm doing here. So it's when I exhale is when the belly comes in and it's an effortless inhale and I bring the belly out. So that's how it works. Um, Again, it's a little bit more of a intermediate type of breath. It will also heat the body up. So just kind of keep that in mind as well. So that's uh, the breath of fire. And then I'm going to show you one more, which is Tumo. I don't know if you've ever heard of Tumo. There's actually quite a few different types of Tumo, but this one, what this is a long exhalation while you're moving that abdom, abdomen in and out. And again, what this does is it improves the strength of the abdominal muscles and it improves the duration. So the difference between this and the breath of fire is that with this one, you're not inhaling, exhaling. You're doing one long exhalation while you move the abdominal area in and out. So here's what it's going to look like. And I'll go from the side. So we breathe in. And then when I exhale, and I'm exhaling this entire time as I bring the belly in and out. And I purse my lips when I do it. So it's almost like a combination of the straw breath that we started out with because it's that slow, long exhalation. And again, I purse my lips when I do it. But instead of breathing in and out every time I bring my abdominal in and out, I'm always exhaling. So that's the Tumo breath. And that's more advanced. So again, if you can't do especially the second and third type of breath, just keep working at it because it's just like anything else. The more you practice it, the better you're gonna get. So here's my recommended practice for the first month. So every single day, do the seated side bend that we learned, where you're stretching the rib cage and hold it for 30 seconds on each side. Um, and you could do one. If you want to do more than that, that's fine. But really, just doing that one time for 30 seconds every day is going to help you out. And then the straw breath, do 5 rounds. So you would exhale, and then you would inhale, exhale 5 times, and do that for 30 days. And the best time to do this is actually right before you play the clarinet because then you're going to really get those lungs working and your rib cage working before you practice. That's the first month. And then starting in the second month, see if you can start holding the side bend for 45 seconds on each side. So again, you're stretching those intercostal muscles and creating more space for the lungs. And then the breath of fire, see if you can start with 1 minute. And again, that's 1 minute seems like not that long, but and if you can only do 15 seconds, do it for 15 and then maybe do 4 rounds of it. But see if you can start with a minute and then work your way up to 2 minutes. And again, do that for 30 days. So every single day, just do that. It's 2 minute, 3 minute exercise. And then the third month and beyond, again, holding the seated side bend for 45 seconds. And then the tumo breath is what you would work on next. And with that one, again, you're inhaling and then using that straw breath as you exhale, but then you're bringing the belly in and out as you continue to exhale. And again, what that does is it's really going to help and strengthen the abdominal muscles for better support, better control, as well as increase the duration of your airflow and the speed. So, questions. Let me stop sharing here. Um, and did anybody have any questions? Tommy, let me unmute.
He's got to unmute himself too. I just had to do that.
Yeah, there you go.
Okay.
Okay.
So can we do these exercises in conjunction with long tones? Because it sort of feels like long tones to me.
Yeah, I wouldn't actually, I don't know. You could try with your clarinet. It's a really good question because, to be quite honest, I've never, I mean, straw breath is kind of, playing the clarinet.
Yeah.
But the other two, I've never really actually tried doing it with the clarinet. So I'm gonna have to try it.
All right. Worth a try.
Yeah, I mean, it's not gonna hurt
Not
anything,
going to hurt.
but
Exactly.
it might be a little complicated with the embouchure and everything. I don't know.
Well, I was thinking also when when you're pursing your lips and blowing out, it's sort of like you're fixing your embouchure and like you're blowing through the mouthpiece.
Right, right. Yeah, yeah. That is really true. Yeah.
Hmm, cool.
All right.
Very good.
Daniel.
Um, what length of when you're playing clarinet, are you a clarinetist or flutist?
I'm a clarinetist.
Okay. When you're playing clarinet, what do you find? How long can you hold a pitch? Because I've sort of been having some back trouble the last couple of years, and I'm sort of concerned. I used to have a pretty large lung capacity, and now it seems like I don't. And I'm at about between 25 or 30 seconds if I'm going very slow, not too resistant of a reed. And I'm just wondering, what's the normal, what can you do? I mean, and there is a difference between when you're playing or when you're holding your breath or, whatever. What's your time as far as, just to judge on something?
Yeah, yeah. So it also depends. Are you, forte or are you, double piano, right?
A
So
mezzo forte. Yeah.
yeah, probably a mezzo forte. I would say if you're doing 30, 35 seconds, that's actually pretty good for long tones.
Okay.
You mentioned lower back issues. Do you have any pain when you start exhaling really,
Um,
or anything like
well,
that?
to to be totally honest, well, it's a mixture. It's basically scoliosis, and then my back is starting to compress so that my the bottom of my ribs is hitting the top of the hips, and so I've got pain all the time. And when I play, sometimes I use a brace, basically a 6-inch wide support thing
Yeah, yeah,
that
yeah,
I
yeah.
use that I can actually push against as I'm playing.
Mhm.
But I'm sort of concerned because before I never had any pain when I was playing, and now it's, I have pain from posture, but I'm sort of concerned if it's starting to affect my lung capacity or my, how long I can go without needing a breath as far as making a phrase.
Yeah.
These
Well,
exercises look
I
like
would
they,
say as far as compression in your spine, remember that the back side of your rib cage is connected to your spine. People don't realize that, but it is, and so if it's especially, I would say kind of lower to upper thoracic area, which is kind of the middle part of your back. If it's
yeah,
in there that it's compressing, then it could affect your lungs. But if it's more lower back, I would say probably not. I don't know if they would be, and I'm not a doctor, so
yeah,
but I don't think that that would affect the breath. I
okay,
did ask you
yeah,
about pain because pain would maybe cause a little of that. you know.
yeah. And this is pretty much just all lower back. So, but these
Yeah.
exercises look like at least, um, how could I say it? They wouldn't hurt, and they probably would help extend my breath.
Yeah, and I really think all of them, but especially the Breath of Fire and the Tumo. Most people that have lower back issues, sometimes, not always, but sometimes it's because they need to strengthen their core, and these are definitely strengthening your core. So it might actually help your lower back issues.
Okay, yeah, they look like that. Yeah, and yeah, that's a phrase that I've heard numerous times of as far as strengthening my core and.
Yeah, because the thing is like, yeah, you are pushing and pulling in and out with the abdominal, but what people don't realize is the core is really a barrel, right? It's the whole
Okay,
thing. It's the sides and it is the lower back as well. People think it's just the front, but it really isn't. Think of the whole core area as a like I said, like a barrel.
okay.
So, yeah.
Just another question. I've had teachers where um, one was that they put their fist in your stomach and say, "Okay, inhale and push my fist out, and as you exhale, keep pushing." I had another teacher that said, "No, just breathe in, blow. It's just you don't do anything. It's just natural." What should we do?
Yeah, yeah. There's definitely two trains of thought on that. And for me, what has always worked is actually pushing out. So think of, the air really doesn't go into the abdominal area. It just kind of feels like it because your belly comes out because of the
Okay,
diaphragm. It's going to come out. But if you've got the body awareness to almost think of like pressing against the inside of the abdominal wall and pressing that out, to me that works better than just blowing. Because to me, I just feel like I'm supporting the air and I can really work with that airflow much more
okay.
so than if I just, you know.
Do do you find I'm a very, very beginning flute, trying to pick up the flute. But the big thing that I found compared to saxophone or bassoon, where you have a built-in resistance that you're blowing against, with flute, there is no resistance in the
Right.
mouthpiece. Do you find that even just knowing how to, play rudimentary flute helps your breath support because you're not,
You don't have that resistance. I
right,
know what you're talking about.
and
Yeah, I
you
don't play.
don't have anything to
um,
push against.
Yeah, yeah. I played flute a little bit in college because I'm music ed and you have to learn all the instruments. But in the last couple of years, I've actually picked up the Native American flutes, and they're the same way. I mean, there's like no resistance whatsoever, And I do think that it does. actually help for lung capacity because of the fact that you don't have that resistance that you do like for clarinet and oboe for sure. Oboe, they're always like exhaling and then inhaling, So yeah, there is something to that.
It's interesting because at one point in my career, I had some surgery or some stomach surgery, and I couldn't play clarinet. And what I did was I just played recorder, which takes, it's not like flute.
Yeah.
There's no resistance, but yet it's to get a sound, it's very easy, and there's absolutely no pressure involved. And
Right.
sometimes someone is going to have some surgery or something. My idea is, well, just get a simple, soprano recorder. At least you can move your fingers, and it doesn't
Right.
take any. Yeah.
Yeah. Yeah. All right. Thanks for your questions. Anybody else have any questions or need a more clarification?
I've got a question that came off of
Sure, David.
what Daniel was saying, and then I apologize because my company has arrived. I'll have to jump off in just a
Okay.
minute. But when he was talking about his back and that, and it's going to that subject too much, but it brought to mind posture when you're playing clarinet to keep it open. So can you just go a little into the postures that are best?
Yeah, yeah. I'm glad you brought that up. So I know for me, and I'm going to put my chair on the side so that you can see, I like to sit like pretty close to the edge, so that I don't have, you know, anything really supporting. So that I don't know, I just find it's a lot easier to get good posture actually away from the chair than to have the back. And then the thing to think about is really with good posture, what you want is the shoulders stacked right over the hips. So if you're, like this when you're playing, the shoulders are in front of the hips. So you want to roll the shoulders back, open up the front part of the chest and the shoulder area here. And, so instead of coming in with the shoulders a little bit, think of those shoulders coming back. And just that alone, right? um changes how the spine is, right? Because like this, the spine is curved, where like this, you've got more of a natural spine. But the thing to keep in mind is having the shoulders stacked over your hips. And pretty much you might have a little bit of a tilt in the chin area, but for the most part, I think most teachers will tell you your chin is fairly parallel. Again, maybe just slightly tipped down when you play. So, does that help?
Yeah. Yeah.
Yeah. And if you are one of those folks that does have some shoulders that come in because we're on our devices and all of that, and so a lot of people do have that where it comes in. Um, you know, to open up another exercise is just doing, and I always go back like a backstroke, right? So you can do some things like that to start to open up and get more range of motion in the shoulders. You should be able to bring the elbow straight up towards the ceiling. Some people, if I'll show you a kind of an interesting anatomical trick. So if you have the shoulder forward, I am trying to bring my elbow up, but I cannot because the shoulder is in. As soon as you bring that shoulder back, the elbow goes up. So, yeah, so think about that as well. If you feel like your shoulders are in, do those types of exercises and always go back. Don't go
Wow.
forward because we're always doing this anyway. Yeah.
That's excellent.
Yeah. Oh, Albert. Albert has a question. He says neither video or audio will open. Any suggestions for more air for those in the very late 80s? Again, what I would recommend is first of all that seated to really get that flexibility. I work a lot with folks in nursing homes and assisted living facilities. And when you tell them to take a breath in, they're this. That's it. It's just a little bit of movement here. And literally their intercostal muscles have tightened so much that it's like literally impossible for them to stretch those muscles out to get a good airflow in. And so for someone that needs more lung capacity, those exercises to really get more flexibility and more range of motion in the intercostal muscles is going to be really important. So start with like that side bend. You know, you could also do like a slight back bend as well, just to open everything up. And then, of course, the breath exercises as well. So that's what I would recommend.
Thank you
Any
very
other?
much. I'm going to jump off because my sister and brother-in-law just arrived. So thank you
Yeah,
for a
thank you.
wonderful seminar. Thank you.
Thank
Bye-bye.
you.
Bye, everybody.
Bye-bye. Any other questions? Clarification. All right. Well, thanks. Thank you so much for coming and giving me a little practice time here. So, and it was nice meeting you all.
Thank you.
Yeah,
Thanks so
bye-bye.
much.
Yeah.
Bye.